Minister, how are you tonight?
Great. Thanks for having me, Paul.
We're very glad that you could join us. We're grateful, as always, to our sponsors at the Canadian Bankers Association, who bring all of these conversations with us. And before we went on online, you were saying that this has been, and perhaps not surprisingly, the weirdest 3 months of your political career. I don't know if you have any sort of opening thoughts to sum up this journey that you've been on with all of us since this crisis began. Where are we in the kind of arc of this management of this crisis now?
Mm-hmm. That's a broad question. I'll say, for me personally, I think you know that I had 9 years in public health at the local level, and I remember joining public health in my mid-30s. Meeting with the epidemiologists. Of course, didn't even know what one was when I joined public health, as so many Canadians didn't until the pandemic, and hearing about the potential outbreak of a pandemic, that we were due for the big one, was kind of the narrative. And if you talk to public health officials, this is kind of the narrative that underpins almost everything, if you will, in public health. And I remember in my 30s having quite a bit of arrogance that, humans have come a long way in terms of science. And surely we would have the ability from a technological and a science perspective to prevent that and also to manage it. And so to be the health minister at the time of a global pandemic, the likes of which we haven't seen in size or intensity in 100 years, is really quite sobering. In terms of the question around how we're doing as a country, I would say we're cautiously optimistic that we're flattening the curve together, as you know, and you can see the data yourself. Our cases are going down. We've managed to avoid that kind of crushing surge on hospitals that we've seen in other countries, including our closest neighbors and friends to the south of us. But that doesn't mean that we're out of the woods yet, because of course, this is a virus that can quickly multiply, and we have to keep vigilant, and we have to continue on the path that we've been on for the last several months. We have, through our work as Canadians, managed to carve out the space to be better prepared for outbreaks that may be more localized in nature, but we have some big decisions ahead of us as a country as well, in terms of how we increasingly restart our economy and rejoin the international world.
I think when the lockdown began, which would be roughly in the second week of March, a lot of people were under the impression that this would last several weeks, and then we'd be fine somehow. There'd be a vaccine, or we would have herd immunity, or this was going to be something that would consume our spring, but at some point it would end. And from friends, from people that I see writing online, there's a sense of frustration that this new lifestyle that we have may only be beginning. What can you tell people who are wondering, well, wait a minute, wasn't it supposed to be over by now?
Yeah. Well, first I'd say I completely share their desire to go back to what we called normal. I think it's a strange phenomenon to be the health minister, because I'm also just a regular human being, and I miss all of the aspects of regular human life. I would love to go out for dinner with my friends, or go grab a glass of wine, or be able to go visiting in my riding to all of the different events that were planned for the summer. It's Pride Week in Thunder Bay coming up, and this is a huge accomplishment for my community to have such a great history of 10 years of Pride in Thunder Bay, and the parade last year was fabulous, and I want to see it again. So I feel that anxiety and that frustration. I can say also that as we learn more and more about the virus, I think we will start to see more and more quote unquote normality. But right now, given that we have limited options in terms of treatment and limited options in terms of protection, in terms of a vaccine, we do have to be more cautious, and we're learning together how to do that. And it is painful and it is slow, but I will tell you that I've never seen government work as hard in my 5 years and as collaboratively on an issue as I have seen them work on this one.
How worried are you about a second wave? What's the likelihood of really substantial new increase in infection rates?
I think everybody is worried about the coincidence of additional infections along with the increase in flu activity that we see every single year. We know that influenza picks up its activity actually somewhere around now and starts to gain steam into the fall and winter. And what we really want to do is make sure that we're not having a surge of flu at the same time as we see surges of coronavirus. Because remember, the goal is to protect our healthcare system, because when the healthcare system has capacity, they can actually save lives, even those with coronavirus that are severely ill. But when the system is in surge and we have ICUs full to the brim and doctors are in a position of having to decide who needs the treatment more, that's when we see a greater loss of life. And so I am worried, but I also am confident that the provinces and territories are doing what they need to protect their system, and that we at the federal government are supporting them with the resources and tools. We have a much better idea as well about how to really understand where those infections are and track them very closely, as well as containing those close contacts. And that work that we're doing right now is going to help us manage potential outbreaks, fingers crossed, but it will take all of us.
We'll get a lot of chance to talk about the current situation and about what comes next, but I want to do a little bit of retrospective. When did you know that this was not going to be, just another blip or just another risk that we could overcome? When did you begin to realize that this was going to be really serious, and that your governing agenda, your mandate letter agenda for this entire term in office was going to be on hold for a while?
It's a good question. I think I had a growing sense of dread over the several months that we saw this pick up steam in China, first of all, and then as it sort of started to transmit around the world. I had a growing sense of anxiety that we too were not going to escape being hit with the coronavirus. And I think obviously the weekend, that we made the decision to close the border was a very profound one, a very, as you know, difficult decision. I think an important one, but it was for me. You could feel the ground shift. You knew that. We were trying to manage this, as you know, from a very, and I think we were doing a good job from a very sort of preventative space. But I think when you take a big decision like that has international consequences, that is not so easy to unroll. I think you know that you're in a new world, that this is a new world, and that rapidly countries were making those decisions as well, and that it was going to be very hard to imagine going back to normal, as you said earlier in your last question.
Okay. There's a special cabinet committee that meets. Its first meeting was on March 4th. The lockdown begins on March 12th, heading into that weekend, 13th, 14th. Already on February 25th, you had suggested that people might want to go out and start stockpiling vital necessities, which was a statement that at the time seemed quite jarring. Was that an expression of this dread that you're talking about?
Yeah, listen, I to be clear, I never used the word stockpile. I know that was how it was reported. What I asked Canadians to do was to prepare for an extended period of illness of themselves or their loved ones, because we knew that people that were getting coronavirus, the Canadian cases that we had were demonstrating that this wasn't something you got over in 3 days, and that also you had to be quarantined or isolated while you were sick. So I was asking Canadians to be ready. And yes, I wanted to indicate to Canadians it was serious. I wanted to let them know that, because of course, as you remember back in those early days, what feels like so long ago, there was a lot of chitter chatter about whether or not this was real or not, or if we were overreacting or underreacting. And I wanted Canadians to know that it was real, and that we were seriously concerned as a government, that we also wanted Canadians to have that time to think about what they would do if they got ill. And so that was the nature behind my comments. But yes, I was feeling increasingly concerned because we now had local cases. It's hard, isn't it, when you see something happening in another country across an ocean, to really sort of grasp the feeling of that. You can see it, you can read the research, you can watch the numbers, you can even talk to officials from other countries. But as we got our local understanding of how this was impacting Canadians and the true severity of the illness, I was growing increasingly concerned.
A lot of your statements at the time, and not only your statements, not only Canadian officials, but in the United States and in Europe, there was a repeated statement at the time that the personal risk to Canadians was low. And yet you had to know that it wasn't going to stay low for long, that once community spread starts to happen, then we're in a very different picture very rapidly.
Yeah. Listen, it's a fine balance in public health. The measures have to be commensurate with the risk. And of course, you don't want people running around in a panic when there really is a very low risk to their health. When we said that, there was very little disease activity in Canada. There were very few cases. We were really on top of any cases that were imported from international travel. We had no indication of community spread. So those were accurate statements. At that time, the risk was low. You know, I would say at this time, depending on where you live, the risk might be low. But it, again, is a much higher risk than it was because we know there is community spread. And I think as we see increased domestic travel even happen, of course, we all have to be vigilant that we protect our loved ones and ourselves from contracting the virus.
Let's talk about that very different profile that the epidemic has across the country. I looked at some of the numbers today, and even when you kind of know it, it's remarkable to do the math. Ontario and Quebec between them account for 94% of the deaths due to COVID in the country to date. Alberta and BC account for 80% of what's left. In most of the provinces and all of the territories, there essentially is no pressing crisis. There have been no deaths in New Brunswick and on Prince Edward Island, none in the territories, and 94% of the deaths in 2 provinces, really substantially in Toronto and Montreal. What kind of challenges does that present?
It's a really big challenge because, of course, some of the measures that we've asked Canadians to take, particularly around social distancing and physical distancing, doesn't make sense sometimes for a community like Manitouwadge in my riding, which is far off the beaten path and has no cases and hasn't had a case and isn't really near anyone that is experiencing an outbreak. Nonetheless, we also know that, again, there is a risk to even small communities, and in a way, especially small communities, because I think about even 2 or 4 cases in Manitouwadge that multiply to 8 and then quickly 16 cases, and all of a sudden their hospital is in deep trouble because it's tiny. And that's the case with Indigenous communities and more remote communities. And as we've seen, when we have an outbreak in a plant that maybe isn't actually in a large center, but then somehow because the workers live in these small rural communities, it can create quite a crisis. And so we really are all in it together, although experiencing it differently. And the amazing generosity of Canadians to take it seriously, no matter where they live, has been one of truly the most remarkable things that I've seen.
Do you think that's tenable over the summer? I mean, if I'm in New Brunswick, why should I not be going out to a park? Why should I not be, reopening my hair salon, whatever?
Well, I think that's why we have the principles and the guidance that was developed as a framework with the Prime Minister and the provinces and territories that was agreed upon, that allows for that local and provincial flexibility to be able to set guidance that's appropriate for their own jurisdiction, and provinces are leading the way with their chief public health officers. I speak every week to my local public health officer and the chief of staff at the hospital in Thunder Bay to get a better sense of what's happening in the district. And they're, taking measures within their own jurisdiction to protect the health of their citizens, while also looking at measures that they can take to alleviate some of the restrictions. And that's going to be, again, local public health decisions. At the national level, by the way, there never was, quote unquote, a lockdown. We were really obviously giving advice nationally, but at the provincial and territorial level, that's really where those particular regulations came into place about whether or not shops could be open. I mean, in BC, for example, they didn't have a complete shutdown. There were many sort of stores that were allowed to stay open. So again, our job at the federal government is to support sort of a federal response. We've got some specific jurisdictions. But I think Canadians know that they have to stay on guard, and I think that they know that they have to follow the requests of public health at their local and provincial level.
Is there a sense at which we've gotten lucky so far? I mean, I know there were specific communities of genuine, deep concern, Indigenous communities, the homeless, where there hasn't been a huge flare up in a big homeless shelter. Indigenous communities have largely been spared. Are there? Do you have blessings to count?
It's interesting because I think some of the solutions are ones that we've known for a long time. Listen, overcrowding in a homeless shelter, I used to run one. It's not good for COVID, but it's not good for a whole bunch of other things, including many other infectious diseases. And so what was really positive to see was that large cities in particular, and smaller ones like the one that I represent, took action immediately to protect homeless populations, whether it was through, distributing people across the city in a different way so that they could have better spacing in shelters, or putting people in hotels, or in some cases, rapid housing programs. I think it's really, hopefully, been the wake-up call that we all need as legislators, as politicians, about the importance of investing in vulnerable people and how equity actually pays off for all of us. I mean, I've made this argument my entire working career that when we invest in vulnerable people, it's good for everyone else. And I think COVID is really driving that home. So who knows? Maybe it's a bit of luck. Certainly, it's also a bit of really prompt action on behalf of local and provincial authorities who recognized early on they were going to have to take specific measures for specific vulnerable people. I'll also point to long-term care, though, and we know that vulnerable population has not fared so well, and there's so much work to do there.
And I think we will be talking about that in some detail. When this began, had you been briefed as minister? You've been minister for a month and a half before all of this began. Were you briefed in those crazy first days on pandemic preparedness plans, or was that so far off the radar?
It's interesting. I actually knew that Canada had a pandemic plan, as I mentioned, from my previous work. I also was thrilled to be the minister responsible for the Public Health Agency of Canada because of my connection to public health. So I understood a lot about the principles of public health. So I had just finished actually all the overview. You get all these binders as a new minister, and you read about every little agency that you have the responsibility for and what they're working on and their programs and et cetera. So I'd actually just finished that work. And I was first briefed by Dr. Tam in early January about the suspicious cases that were being reported out of China, and through the early warning system, and her work with the WHO. And at that time, that was the first we heard of it. But again, it was very early days, so it was not as alarming, just because I do have that background in public health. So I knew that there was an alert system, and I knew that this was sort of normal behavior for public health officials to be on guard for this. But yeah, it was a very, very fast coming to speed with the Public Health Agency of Canada and its role in our country.
Once we're really in it, once there are cases in Canada, the first deaths in Canada, the cabinet committee starts under the chairmanship of Deputy Prime Minister and Minister Duclos. What was your planning horizon? Were you trying to, were you grappling with this thing 2 or 3 days at a time? Were you looking forward to getting over the hump at the end of May? How big was your window into this thing as you got into it?
I think, early on, as health battled through the health crisis, as it was, as you know, in the early days, and we added measures for screening, for example, we were working, the provinces and territories were gathering and meeting as early, I think their first meeting was on January 15th, something like that, maybe even a few days earlier. It became clear to me, probably in early February, especially when you looked at the experience of China, that should we get to the state where we had a surge like we were seeing in other countries, that we would have massive disruption in many other departments and many other sectors of our economy, for example, in our transportation, in our food sector potentially. And so I was very grateful that the Prime Minister pulled together the special committee, because I knew that we could not manage all of that. And in fact, I likened it to a tsunami in a way. It's coming, and those of us are the early alert system of health. Saw this thing coming, and we were preparing from a health perspective, but it was very clear that as those waves were washing on the shores of Canada, that it was going to have a massive impact on other things besides health. So I think the committee's role has been really to bolster the work of health, but also to focus on all those other pieces, like the emergency benefits, for example. Very early, as we were saying to people, you cannot go to work when you are sick. You must stay home if you're sick. We knew right away that if people didn't have a replacement income for when they were unable to work because of coronavirus, or later on because they were laid off, that we would not be able to be successful at asking people to stay home. So we needed to come together for a whole of government approach, and I think it was a wise decision to pull that committee together when we did.
I get the impression there had been less of that work done in advance. The benefits, the massive government intervention, precisely because for all the pandemic planning, nobody had really anticipated a global shutdown of the day-to-day economy. Was that something?
So apparently there has been some international tabletop exercises just like this that predicted some of this disruption. Luckily, it's funny, the epidemiologists will tell you this is not the big one. This is the dress rehearsal for the big one, which is terrifying. But what a dress rehearsal it is, because I think the world is seeing just how disruptive illness can be to the way that we function as a globe, from an economic perspective, a transportation perspective, from a food security perspective, from all of that. And certainly at health, we had prepared what we called scenario binders for all of the ministers about should we see this kind of disruption, what it might mean. But certainly we needed, as I said, we needed more focus through the special committee to be able to really action those items.
I guess what I'm getting at is there was a binder, a pandemic preparedness binder on public health. I'm not aware of one that says, here's how you shut down an economy.
So true. And what doesn't exist? Here's how you start one up. So that's what the world is grappling with now. I mean, take the issue of international travel. There is no best practice for how you reopen the borders once the entire world has, to some degree or another, stopped international travel. And so we are working with international partners and with the IATA and all kinds of different organizations to look at what will inevitably become a new world order about how we screen from a health perspective in a more comprehensive way. But these are all things that I think the international community is grappling with, and I'm very lucky to have colleagues that are taking that on, because as you know, the health portfolio is a very full one, and so I can feed in from the perspective of what does health think and what does health need to do, and how do we participate in having the focus being protecting the health of Canadians. But I do need my colleagues, and we need the whole of government to be working together, because this is a challenge like we have not seen in a very long time.
And government's plural. I mean, federal health minister famously doesn't have levers on most of what people think of when they think of healthcare. You run. Federal government runs military hospitals, some hospitals in Indigenous communities, doesn't run 90% of the hospitals in the country, doesn't handle the spending, can't open or close most businesses. Federal-provincial relations have been a little tenuous in this country for longer than the Trudeau government's been in power. Federalism has kind of become a bit of a rusty machine. Did you have to relearn very quickly how to work with the provinces? And what was that like?
Yeah, I luckily had not, thank God I wasn't a baby minister, brand new to the job, because I knew the mechanisms of how to interact with the provinces and territories. But here's what I will say. The formality of that broke down over the time that we have been dealing with the pandemic in a positive way. So, for example, every minister of health across the country has my cell phone number, and they call me bilaterally whenever they need to talk to me about whatever the issue is, and likewise, I can call them, and we do. And we also have regular meetings in sort of the crush of it twice a week, now once a week, to talk about some of the more systemic challenges, what kinds of supports they need from me, what's going well, what's not going well. In many ways, the pandemic has broken down some of those barriers that exist. Now, will there always be tensions between provinces and territories and federal governments? I optimistically would like to say no, but I think the reality is yes, because we have just different jurisdictional issues, and often it is an issue of quantum of money transferring. But I am really thrilled about the transparency and the immediacy of those relationships that have allowed us to get through some pretty difficult things together.
Do you anticipate those very close and tightly integrated interactions coming to an end? I mean, here's my naive tip: is I kind of think a federation should work like that most of the time.
No, exactly. It would be wonderful. Listen, I hope not. I personally feel, and maybe I am naive. I've been accused of being naive before, and I'll take it. But I sort of feel that I've been developing personal relationships with these individuals, and I will say that no matter what level of work that I have conducted in my life, whether it's been the executive director of a shelter or a planner at the health unit or a minister of the Crown, I have learned one really important thing, and that you can't do anything if you don't have a relationship with the person that you're trying to interact with. You actually have to have a relationship, and you may not always agree or even like the person you're working with, but there has to be a foundation of respect and openness to looking for a shared solution. And that has served me very well in all of that work. It's not perfect, and I am human just like everyone else, but I truly believe that this pandemic has taught us that this isn't me talking to the government of Ontario. This is me and Minister Christine Elliott working together on solutions for Ontario in a very challenging time. And if I can remember that, and hopefully my colleagues can remember that, we can get pretty far.
Okay. A couple minutes ago, we were talking about international travel. You have, to me, sounded skeptical about the usefulness of closing borders right through the piece, from before the Canada-US border was closed, before travel restrictions were put in place. You're obviously a team player, part of a cabinet, part of a government, part of a global response, but you've never sounded like you believe that's the response to this crisis. How come?
Well, I think in the early days, first of all, there's these things called international health regulations, of which Canada is a signatory to. And so those regulations say during an outbreak, during a global outbreak, in fact, that we should not shut down our borders, and we should not in any way inhibit trade or travel, because in fact, the most effective way is to do screening at the borders and to try to catch those cases. I think what happened for me, though, was as we saw the pandemic evolve, what became clear is that the transparency of other countries was maybe, I shouldn't say transparency, maybe it wasn't transparency, the capacity of other countries to understand what their own disease outbreak looked like was not there. I mean, if you remember, Italy, who had some of the strongest border measures, by the way, if you can recall, shut down their travel measures, had an enormous outbreak of which they were unaware until other countries were importing cases. Same thing with Iran. We had cases popping up in BC in early March from Iran. Iran had no reported cases. So it became clear that the principles which underlined those agreements were broken because people were not actually reporting up these reportable cases, either because they didn't know it, or they didn't have a reporting structure, or they weren't being open and transparent. And that was making it very, very difficult for us to be able to track and trace new cases, because you kind of have to know what countries you're dealing with. And it became clear that it was really every country, and we were going to have to take stronger action, at least in the interim, to protect and flatten our own curve.
Okay. Would you put China on the list of countries that haven't been entirely transparent about how this has been going?
Listen, there's been questions about China's transparency at the beginning, whether they knew what what they knew, how much they reported, and the timeline. I will tell you this, the thing that I think I shouldn't say it's saved, but certainly helped the world, was getting that sequence of the gene code for the virus very early on, which allowed Canada to rapidly develop tests and be able to identify cases in our own country. But listen, I think there's going to be a post-pandemic review of all countries' actions, and I'm certain there'll be lots of questions about China's actions in those early days.
Okay. There are more generally questions about this government's stance on China. There was already a parliamentary committee meeting on Canada-China relations, one that was imposed by the opposition parties over Liberal Party objections. And there's a lot of people asking, does this government see China as an investment partner, an ally, or does it see it as an increasingly belligerent force on the world stage? That question's a little outside your remit, but you are a member of this government. I thought I would ask.
I think our government's always been clear that the way to manage, even with difficult countries, is one of collaboration if possible, but for sure communication. We know that and I think we've been very open about this, that our stance is that it's better to talk to people, even if we don't agree with their principles and their values, than to shut them out. And so in terms of a global health response, listen, we're not going to be able to beat down any global illness unless we actually work together with countries. And there's an opportunity, I think, to welcome countries to the table to participate in those conversations with a healthy degree of questioning, but for sure knowing that to manage any global outbreak, you actually need all global citizens to participate. It's just like saying that you can use the analogy that if we were trying to do this and Quebec was having no part of it, or Alberta was saying forget about it, that we would still have a significant health risk if we had a province amongst us that was saying we're not going to follow the rules, and we're not worried about this, and you guys are on your own. You could expand that to the international community, and that's a principle behind the World Health Organization. It's not perfect. No country is perfect, but the principle is that we're all unsafe from outbreaks if we don't actually include everyone in the response to these significant threats to human health.
Okay. David Naylor, who's been appointed by this government to work on the immunity panel that we'll see. The immunity task force. He has said that because of Chinese obfuscation and the World Health Organization's early response to this, that we lost about 2 or 3 weeks in our response to this crisis. A lot of people are asking quite bluntly, what's the World Health Organization good for?
Oh, so much. I mean, listen, as I said, I think there's no question that we should review the World Health Organization's response to the pandemic, as well as our own countries, as well as everyone's countries. But there is so much value in the World Health Organization, despite any shortcomings. And I will say this, there is no perfect organization in the world. I have run imperfect organizations. I know that the objective of every leader is to try and improve the organization for which they find themselves responsible. But the World Health Organization convenes scientists and researchers. It does provide for early alert systems. It allows for the dissemination of vaccinations for very serious illnesses into countries that can't afford them. There are so many things that the World Health Organization does that we need them to do and to continue to do. They were an important component of how Ebola is essentially being eradicated. I mean, listen, these are really important organizations. As I said, are they perfect? No, but they are extremely important. And I think the next step after we get through these outbreaks and we find a more stable sort of normal is to review the World Health Organization and determine how we can strengthen it together as a global community.
Okay. Let's talk about those long-term care homes. Why did it need Canadian Forces soldiers writing back to their superiors in Ontario and Quebec for public attention and maybe to some extent government attention to focus on what seems to have been a crisis that was already underway before COVID happened?
Mm-hmm. Yeah, it's a pretty disturbing report. I don't know if you've had a chance to read it. Certainly, if you do, there's no way you can read it and not feel horror. In some, I felt incredible sadness. I had a loved one die in long-term care. It was in no way as appalling as what was reported in that document, but nonetheless, the care was not what I would have considered satisfactory. You know, many people are alone in their homes for long extended periods of time. If they don't have loved ones, they can not get the sort of mental and social stimulation that they need. We know, we've heard many stories of families that augment care to make sure that their loved ones are fed. This is not surprising, I think, to Canadians. It's shocking in its extremeness, but it's not surprising. And I think it's a wake-up call for all governments to say we have to do better. I mean, I've been talking about this, as you know, since before the reports, as we saw the deaths mount in long-term care. There are many, many reports that have been done on long-term care over the last several years. And even though this is actually not in the federal Minister of Health's portfolio, I've taken it upon myself to read some of the more recent ones. And one excellent report by Dr. Sinha speaks to the challenges of long-term care, primarily around the way that we value care work. And I've talked about this as the Minister of Status Women, you know that. We have not valued the work that care providers give to the people that we love in these homes, and we have to do a better job. So, as you know, I think today the Premier made some statements about some actions they're going to take, in particular around those care homes, but I think there's a much larger systemic fix that needs to happen.
Whenever these kinds of conversations come up, probably the second question is the federal government prepared to put money in?
I think the Prime Minister was very open to saying that we'll be there to help support provinces and territories, but we obviously do respect that this is a jurisdictional authority of the provinces and territories. Nonetheless, I don't think Canadians want us to argue about who's supposed to fix it. I think they want to know when they go to sleep at night that their mom or dad or grandpa or grandma is living in a way that affords them dignity and safety. Listen, we're all getting there. We're all going to be there one day. And, I think we have to work together to make sure that people can age safely and with dignity. I will say that I'm proud of the investment we made in home care, the $6 billion in the last mandate to increase access to people aging at home. We know that's one part of the solution. The less people that end up in long-term care, the better, but it's not the only solution, because obviously sometimes people need complex care. So the Prime Minister said we will be there for provinces and territories. And I think that's the work now ahead, is in what way and to what, and what will our role be?
Is there room here for a national plan, intense federal provincial collaboration leading to national standards? I ask because I posted an interview with an academic today who called for that sort of thing. And immediately there were people who said, well, wait a minute. We really don't need Ontario and Quebec telling us how to fix a system that's only broken in Ontario and Quebec.
Mm-hmm. Well, that's the challenge. When the federal government steps into a jurisdiction for which it does not have authority to mandate specific approaches, when we know that some provinces and territories are doing very well in the area of long-term care, and some provinces and territories have recently changed how they deal with long-term care, specifically as they saw it affect, as they saw COVID affect the care of the elders in their communities. So this is a collaborative process. Things always work better when you work with provinces and territories instead of trying to dictate to them how to do it. Having said that, I think there is a willingness too. I mean, I had a great conversation last night on my federal provincial call with the provinces and territories about their perceptions on how things were going in their particular jurisdiction and where they're struggling. And there was a high degree of openness to talk about potential supports from a federal perspective.
Okay. This crisis isn't the only thing happening in health in this country. There's an opioid overdose epidemic that's in its 5th year. Probably, I mean, it's astonishing to me that anything is killing Canadians faster than the opioid crisis. But even this year, there's probably going to be about half as many people die from that as die from COVID. And there's growing concern over mental health. People who are facing increased strain from the kind of lifestyle that we're all having to live right now. Are you able to devote some of your time to these concerns?
Absolutely. In terms of mental health, we saw early on that there was going to be a need for additional mental health resources. As you know, we transferred a bunch of money to provinces and territories in the last mandate to boost up mental health capacity in their own jurisdictions. But given the increase and rapid increase in need for mental health supports, we launched something called Wellness Together, which is an online portal where people can go online and get either self-help tools, but also connect to professionals either by phone or text or virtual care. I'm saying this now as an infomercial because I want Canadians to check it out because it's really phenomenal, and we've added resources as we've gone along. We also know we need to do more. We've been investing in things like supporting the crisis hotlines, the suicide lines, the kids help phone lines, ensuring that the domestic violence hotlines can maintain their services, because we've seen an increase in those calls. All of the investments in not-for-profit organizations. We're trying to keep the care industry, if you will, alive during COVID-19, because we know that they're needed even more than ever before. In terms of substance use, I have as you know, a long history in the area of drug policy. And one of the things that I am most proud about in terms of our approach to substance use is the restoration of harm reduction to the drug strategy. And so through that ability to restore harm reduction, that is making safe injection sites easier to start in communities that want to have them, ensuring that people have a safe supply of substance use if the community wants to be using that particular tool. Those kinds of things have been, I think, helpful to communities like Vancouver, for example, and other parts of the province, other parts of the country. There's way more to do on substance use, and part of it is having a broader conversation about substance use and just how endemic it is in all of our lives. I'm looking forward to talking more about alcohol use, which is something that we never talk about in this country, or at least not as loudly as I'd like to talk about it. So, those are the parts of my mandate and the work that I was looking forward to doing pre-COVID that I think actually weirdly coincide with COVID, and that we can certainly sustain during the COVID-19 response.
And I still hear from a lot of people who say the best answer to all of these problems will be to just let people get back to their lives. How long is this pause from our lives likely to last?
That's a hard question, and it's the one I've been asked over and over and over in a multitude of forms since I started this journey with COVID-19. Everybody wants to know when things will go back to normal. I don't know if things will go back to normal until we have an effective treatment or vaccine. I think the challenge with coronavirus is that for many people, it's not going to kill you, but for those few people that it will, it's extremely, extremely dangerous. And so to protect those people in our lives who are elderly, who do have vulnerable health conditions that make them more vulnerable, we're going to have to adapt the way that we live. And I think, even people that get the illness who are well sometimes have a very severe bout of illness. So I think it's going to be a while that we're going to have to learn how to live in a way that really focuses on protecting our health. Now, the good news is there are some things that are pretty simple to do. I mean, we can wash our hands a lot. We're all getting good at this. We're all remembering to wash our hands and use hand sanitizer when we can't find soap and water. We're going to have to stay home when we're sick. That's harder. That's a cultural change. It's also, we have a culture that's very driven, and people go to work when they're sick for a whole bunch of reasons, sometimes money, but sometimes because, we've sent signals as a society that you battle through that sore throat or that headache or that, even that sort of bad head cold, and that has to change. And then finally, we are going to have to stay physically distance for a while outside of our household bubbles. And how long? Well, we are investing a ton of money in our research community and supporting that research that will help us better treat, prevent this illness. And that really is the long-term answer.
Okay. We're heading into the home stretch, probably going to keep you here for another few minutes. We like to end a little short of an hour. But I do want to pass along a question I got from a student who is living with cystic fibrosis and who is concerned because there's a new therapy, a new drug for cystic fibrosis called Trikafta that seems very promising, that is available to patients in the United States and in Britain. But the manufacturer has not submitted it for approval to Health Canada because they say the new patent medicine regulations are simply too onerous, and the price they'd be able to charge is too low. And so a lot of patients are wondering where that file is. What can you tell them?
Well, that information is different than what I have. Yes, for sure. The company has not applied to sell the drug in Canada, but it's actually disconnected from the the PMPRB, the Patent and Medicines Price Review Board. So we anticipate that we hope that they will apply to sell the drug in Canada. But in the meantime, I would say to that patient, there is something called the Special Access Program, which is highly effective. If that patient's physician believes that they would be benefited by receiving Trikafta, they can write a letter to Health Canada for special access to the drug in Canada. And in fact, out of the 96 or so applications, almost all of them have been approved. There is a certain kind of patient apparently that would not benefit from the use of Trikafta, usually when they're too ill, but they should speak to their physician as soon as possible and see if they in fact would be able to get the support of their doctor to write that letter to the Special Access Program. And certainly they can follow up with my officer or their member of parliament to get information about how to do that.
Okay. Thanks for taking that question. And I want to thank you more generally for being so frank and so open to all the questions I had today. I think we'll wrap it up now. I want to let our listeners know that next week my guests are going to be Carolyn Menard, who is the Information Commissioner of Canada, and Yves Giroux, who's the Parliamentary Budget Officer. And we're going to ask about some of their concerns about governance issues in this strange time when everyone's preoccupied with everything else. But for now, Patty Hajdu, Federal Minister of Health, thanks so much for joining us. Thanks to the Canadian Bankers Association for making this all possible. And we'll see everybody real soon. Thanks.